I'm Gavin Giovannoni. I'm the Professor of Neurology at Barts in London, and I'm going to be discussing multiple sclerosis under various different topics. I think it's important to realize that it's the commonest autoimmune disease of the central nervous system, and it has a large socioeconomic impact, and it actually is the commonest disabling non-traumatic disease to affect young adults. Who is at risk of the disease? We do know from an epidemiological perspective, in the past it was considered a rich world disease in inverted commas, in that it affected mainly people from Western and Northern Europe and their descendants. But it's quite clear that over the last 20 to 30 years it's now a global disease, and we're seeing an increased incidence across the world. In terms of what causes MS, we don't know exactly what causes it. There's some different theories around the causation of this disease, but we describe it as a typical complex disease. In other words, you have a genetic predisposition, and then now a large number of variants in the genome that predispose you to multiple sclerosis. But the majority of the risk resides in the MHC, the complex, in the old DR2, now DQW15. It's quite clear that environmental influences interact with the genetic susceptibility genes, and there must be something by chance, because the majority of people with the right genetics and the right environmental exposures don't get MS. So it's the minority, so there must be some chance factor that triggers the autoimmune disease. We do know that the susceptibility is dependent on how much heritability there is. So the highest genetic risk occurs in identical twins, particularly female identical twins, where in countries like United Kingdom, Scandinavia and Canada, the concordance rate in female monozygotic twins is about 30%. Interestingly, that changes with latitude. So as soon as you go down towards the equator, for example, in Southern Europe, the concordance rate drops off. So even in identical twins, it drops off to under 10%. And we know that there is this latitudinal gradient. The further you're away from the equator, the higher the incidence and prevalence of this disease. And we think that is due to vitamin D or lack of ultraviolet B exposure. And there is some good epidemiological evidence suggesting that low vitamin D levels predispose you to multiple sclerosis. And we think that acts not only in childhood and adolescence, but also in the womb, in utero, because month of birth effect dictates risk of getting MS. The other big risk factor is exposure to Epstein-Barr virus. So people with MS almost ubiquitously have the virus, and having the symptomatic infection, infectious mononucleosis or glandular fever, is the real risk factor. That puts your risk up by about 2 to 2.5 times background risk. Other environmental factors are childhood and adolescent obesity. We know now that that's a relatively recent risk factor, and it has been confirmed in numerous studies. And when we've done Mendelian randomization studies, it looks like obesity is in the causal pathway. Another factor that's just recently emerged is solvent exposure and also smoking. We think that may relate to altering the environment within the lungs, and maybe there's some post-translational modification of autoantigens. So there are some modifiable risk factors, which is why some of us think that we may be able to prevent multiple sclerosis. But I think it's clear that these risk factors don't only act later on in life. It's quite clear there is a microenvironment within the womb that predisposes you to multiple sclerosis. Month of birth, as well as other factors that may play a role. So this is why we think epigenetics is important in multiple sclerosis. Just to give you the exact figures, the concordance rate between siblings is about 2.5%. But in unidentical twins, which have the same genetic loading, the concordance rate is 6.5 to 7%, and that is highly significant. That difference, suggesting something in the womb, in the microenvironment in the womb, predisposes you to the disease. So there's lots of epidemiological evidence to suggest that this now is a global disease, increasing incidence worldwide, with environmental risk factors interacting with genetic factors to trigger this disease later in life.